Good afternoon, everybody. We've had a lot of people register for this session today, so we're going to give them about 3 more minutes to arrive. People are still trickling in, and then we'll get started. Okay, good afternoon, everybody. We've got roughly 100 people here now, which is about what I was expecting, so we're ready to get started. If you hear a strange little beeping in, it's because I have to manually let people in from the waiting room, so that's what we're going to do. So a couple housekeeping pieces before we get started. Um, this is on the schedule to be from 2 to 4. I don't expect it to be that long. We're starting a new project here, which is we're going to try to make these somewhat shorter and more content area specific webinars that will then record and release on the web so that even people who have missed it can then go in and refer to these. So as part of that, I'm not sure of the entire schedule right now, but the next one will be coming very soon. So watch your alerts. It will be on enrollment in CSD Cares. We did that last year, but did not successfully record it. So this time we're going to go through the material again and save it and post it. Um, so having said that, I'm going to get started. And this is the point when we're editing this to post it, where the actual posted video should start. Otherwise, you'll have 38 minutes of dead space. So good afternoon and thanks for coming. We're here today to talk about the PIR, which everyone who receives federal funding is at least kind of familiar with. But I wanted to go over this with everyone at the beginning of the year for several reasons that I'll come into. Okay, I'm seeing there is no sound. Can anybody hear me? Yes, okay, so there is sound. That's not on my end. Great. Take two. We're here today to talk about the Head Start Program Information Report. We just submitted this report for 2023 to 2024 2 weeks ago, so you may wonder why we're talking about it already. And the reason is there were some strengths to how we did that and some problems, and we want to go over um, in what the report is, the entire process at the beginning of the year. Much of the information that is captured on the annual report is from the beginning of the year. So if we can have a good September on this front, the rest of the year in terms of collecting and submitting the necessary information for the annual report will be much easier. There are also some other reasons we need people to pay attention to this now, which I'm going to get to at the end of the presentation. So, what is the PIR? The Head Start Program Information Report was first created back in 1978. The idea being that the entire Head Start universe needed to gather data on what happened during the year, what kind of services are being delivered, and what various program elements look like, as well as the demographics of the population served, their demonstrated needs, and so on. So the report needs to be submitted by everyone with Head Start or Early Head Start programs. It has to be submitted every year by August 31st, 2025. There are not extensions to this. That's the set up by law. It's just the way that it goes. So if you look at the PIR, you will see on the first page the introduction that said this is just to gather data on all the programs, and that it's not intended to establish or demonstrate compliance with Head Start performance standards. That, as you may be aware, is not true. So they look at the PIR as submitted, and they look at some things specifically in part certain milestones that you're supposed to hit. They look to make sure that you have fewer than 10% of your children were over income. They look at whether you've got 10% disabilities. They look at developmental screenings, family services, and other things. And they definitely come back to you with pointed questions if they don't like what they see. Okay, so before we get into the details of how we reported it and how we're working on that right now, just going to walk you through it quickly. All right, so what's in it? There are 4 sections. Section A is program information. This is about the program itself, your funding slots, your capacity, and how many children that you served and who they were. The second section is on program staff and qualifications. Then there's section C, which is the bulk of the report, which has to do with child and family services. And the last section, section D, is grant level questions, which are answered at the delegate agency level, but we still will need some information about those. So if you want to see the whole document in advance, you can find this at eClick. That is the Head Start Early Childhood Learning and Knowledge Center. If you have Head Start funding, you should be well aware of this site and visiting it very frequently. If not, you should start. So I've included a link here. Because before the next 5 people ask this, yes, we will be distributing the PowerPoint and a link to view the presentation once we're done. But there are a number of things at eClick that are worth looking at. So this year, if you go to that site, it will tell you that there are no changes in store at this point for the 2024-2025 PIR. So they're talking about using the same form again. They've said that before, and sometimes that was true, and sometimes we got an updated version in late winter, early spring. So again, watch that space, and if we find that the form has changed and we have additional information that we need, we will get that out to you as soon as we can. Okay, so for the past couple years, we've been sharing files with all of our delegates and collecting PIR information in Excel. And we've been doing this because the information that we're getting from our new data system, which is CSD Cares, is inadequate. There's 2 reasons for that. One of which is that the report itself is kind of difficult to work with. But the big reason is that our agencies have not enrolled all their children and recorded all the services in CSD Cares. So when we do run a report, it's missing information and we can't submit it that way. So if you want to get out of spreadsheets, this is your big opportunity this month to get all of your federally funded children enrolled in CSD Cares with the proper information. And then we'll be able to let go of the spreadsheets. And so we can look in there and see that this is what we're doing. So we've already shared these with you. And I just want to point out a couple things about it because I just assume, having spent the last 20 years with my head stuck in Excel spreadsheets, that everyone knows how to do that and work with that very closely. But the truth is, it's not as intuitive as I'd like it to be, and it just assumes certain experience that you may not have. So a couple things that have frustrated people with the shared spreadsheets. Um, the first thing is when we pull information out of the spreadsheet, we're doing it by grant, but to make it simpler, we've asked you just to include all the children in the same sheet, and then we can filter it by the grant that's funding the particular child. So if you've got like a Head Start, an early Head Start program or 2, we do have a couple agencies with 3 different early Head Start funding streams through DFSS. So if you look in there and you're saying, we can't see all of our children, that probably means one of the fields is filtered. If you look across the headings at the top of this page, there's a little symbol, and I've tried to include a bigger version of the icon there. It looks kind of like a pour over coffee filter. And so that's the filtering icon. If you click it, you can hit clear, and that'll turn into just a little down arrow, and it is just unfiltered. The second thing is people are asking which fields do they need to fill in. We coded this. I say we, but I didn't do it. But these were coded so that the required fields are yellow when they're empty, and when you fill them in, the yellow goes away. So that's how you can tell. And then for many items, because the PIR form itself has set responses, and we have to, for every child, we have to give one of the responses that are on the PIR. We have included a drop-down menu, and you can only pick the responses that are on the PIR. So please use those if those are there, and don't go in and type something else in, because there's nowhere to put that on the form. So we'll need to come back and get you to pick an item that is on the report. Okay, having gone over the basics, so we'll start with section A. classes, groups, and centers, first section. We want to know the program option, how many are center-based, how many are home-based, how many are family childcare, how many classes, and were any services delivered through childcare partners. And then we get to the enrollment section, and they want to know how many children were served, and something about who they are in terms of demographics, whether they're new enrollments or returning, and attendance. So I'm going to take a look at the program information. So the reason we set up the classes page the way we did is to answer various questions that are on different parts of the report. So first of all, we want to know how many classes were operated. And then there's a field there we ask if were these operated by partners. We're trying to get a sense of who the teachers were in each class so we can see what the number we need to hit when we get into breaking down teacher um, qualifications and turnover and things like that. Okay. So the next thing the report asked about is cumulative enrollment. Um, we do need to fill out some pieces about them. They want to know which children are new because there are more expectations about what we do with those children. We also need to get a sense of the turnover, and was going to ask about chronic absences. So we put all of this on a single tab. And you should be able to look at this now because we have already shared the 24-25 spreadsheet with everybody. That seems really early, but I'll get to the reasons we're doing that again in a minute. We also added notes this year. So if you look at the spreadsheet that we've shared with you, any heading that has a box in the upper right-hand corner, there's a little red triangle. If you hover over that, it'll give information about that. Most of the information comes from the PIR itself. I'm not sure if we got into this yet, but we're also going to take a PDF of the reporting form and put it in everyone's folder so you can see for yourself what we're asking. But a lot of the language has been transferred from the form or from eClick, and we've just given more specific directions here. So we need all of the fields on that filled out. I know a lot of people filled out the first maybe 20 fields and then that the rest of it didn't really apply and left it blank. But there are a number of reasons why we need the information. We're not really asking for it because we love playing with spreadsheets, because believe me, we don't. Um, so chronic absence was one of the big issues that we had difficulty reporting. Um, So what they're looking for, according to the performance standards, they have defined a condition called chronic absence, which means the child is present less than 90% of the days or absent more than 10% of the time. So that means if you have a month, your typical month has maybe 20 class days. If the child was absent more than 2 days for a month, you would say that they're chronically absent for that month. But we're actually looking at that on an annual basis. Um, we're doing that because of a study that was done. It was actually done in Chicago. And what they did is looked over a number of years at children who were in preschool programs and then what their later academic performance is like. And what they discovered is children who are chronically absent are more likely to have difficulties later. They're more likely to drop out of school and so on. So there was a big finding again in our communities. And so they've decided to track this and try to build an understanding among people in the Health Head Start community that we need to work on bringing attendance up. So when they talk about chronic absence, they're not making a distinction about excused absences. This does not matter. That's not how they looked at it when they studied it. So it doesn't matter if they're excused or not, if they're less than, say 18 days a month, for whatever reason, they are chronically absent. And then we'll need to know reasons, and the reason might be a child has an ongoing illness. Family likes to take the family to Mexico on vacation. There could be a number of things, and that's what they kind of want to know. So they're looking at why children are absent. And I stress this, and the reason I say it was a problem to report is I don't have a lot of confidence in what was reported. And the reason I don't is that we have, for a number of years, been trying to work with agencies to identify um, which which sites are below 85% attendance and um, work with them on what are the causes of attendance, how do we address this, how do we get parents to bring their kids consistently to the program. And it's been difficult for many people to maintain the 85%. Even if you do that, if your attendance is 85%, then you do have a number of children who are there less than 90%, because that's just how math works. There's no other way you can get your attendance down that low. If everyone was there at 90% or more of the time, then your attendance would be 90% or higher. It's not. So we do need to keep track of who those children are who are absent. Okay, so that's the explanation on there. This is a new section in the last couple of years in the PIR, so people aren't quite used to looking at attendance that way. But again, it has been included in the new performance standards. But by the way, just as an aside, there are new performance standards, which I saw on eClick when I was getting information to put this webinar together. So if you were not aware that there are new ones, you should really go to the eClick website and look at some of the differences. Some of them are small, but some of them are quite profound, including the section on mental health. So go check it out. Okay. The next section is program staff and qualifications. We need to know this. One of the reasons we're asking now, because if we set this up correctly at the beginning of the program year, it'll be easier to keep on top of this and keep on top of turnover and so on for the rest of the year. So the first piece that it was difficult to get from everybody, I will say, is volunteers. If you are counting volunteers as part of your in-kind for your federal grant, you have to have them. So we need to find out the number of volunteers that you had and the number of those that are current or former parents. So again, from the federal website, it says to include both classroom and non-classroom volunteers. Count each person once, regardless of the number of times they have volunteered in the program. So this should be answered by grant on the general info tab. So on the spreadsheet we gave you, there's a page called general information that maybe half of people filled out. We do want that in right away because we want to make sure that we have the right contact information for you so we can follow up about any information that we need. That's also where the volunteer information is found. It doesn't take that long just to put the number in. If you get more later, you can add it. But we do need to track that. And again, if you don't have volunteers because of infectious disease concerns or other concerns, you just need to make sure that's reflected in your budget in the in-kind and all of that. Most people cover a lot of that with volunteer labor. Okay. So the program staff. We do need some information about who works at each delegate in order to satisfy this reporting requirement. So this is who was included, because it's not necessarily everyone who works for your organization, but it's also not limited to people who are on your Head Start or Early Head Start budget. So we need to, for the overall question, we need to report on everyone, including people who left the program. For the teaching staff sections, that's what B3 through B15 are. And I guess this was a part that was confusing to people and made it difficult to get the information we needed. If more than one individual held the position during the year, we need to report on the last person who held the position. But if the position is vacant, we can't put vacant. We're not able to report Miss Vacant as assistant teacher in classroom B. So if we have, say, 6 classrooms at a site, there have to be 12 adults, either 6 teachers and 6 assistant teachers for Head Start or 12 teachers for an early Head Start program. And you can have more than the minimum indicated by the number of classes you have, but we can't report less. So if the position is vacant when we're making the report, we need information in there on the last person who held the position during the year. And yes, this does include substitutes or temps. Just because someone isn't a full-time employee of the organization doesn't mean you get out of reporting them. The only difference is they are reported under contracted staff instead of permanent staff. That's it. Otherwise, we need all the same stuff. Because we need to know who is in the room. And then for turnover, there was a question about teachers and home-based visitors who left the program during the year. So we need to know anyone. So next year, we'll need to report on anybody who leaves the program after the beginning of last week, so after September 3rd. And we'll still need their information on there, and then we'll need to know when they left, why they left, were they replaced, and how long was the position vacant. So rather than trying to assemble that at the end of the year, putting that information on an ongoing basis will end up being much easier. Okay, so more Q&A from the eClick website. When reporting on program staff, should we include all staff or only those directly involved with the program? We have a large multi-state agency with multiple funding streams and multiple Head Start programs. So Section B of the PIR, only report on staff who work in that Head Start program, assisting its staff or delivering services to its children and families. But notice this definition doesn't include whether they're on the budget. Like if the teacher is being paid for out of Preschool for All, but there's still Head Start kids in the classroom, they're still on the report. Okay. So the question then they ask about teacher assistants. So the way that the PIR is phrased, they're only asking about teachers and teacher assistants. And to distill this answer down to simple to understand way to look at it, you need to have 2 adults in the class. You can have additional assistant teachers that you also report, but you have to have at least 2 teachers in an early Head Start class. So we're changing their job title to assistant teacher because they do not have the qualifications that we're looking for. Does not work if that leaves fewer than 2 adults in the class. So if those are the only 2 people, they're still teachers, whether or not they're qualified. And that's how we have to report it. Okay, the next section is classroom teacher salary by level of education. I know that people don't want to give us this, but we're required by law to gather it and give it to the feds. That's really all I want to say about that. You don't get to keep your information secret if you're going to take money from the federal government to deliver services. Once you've done that, they get to ask you how they spend it on what, which includes your salary. So it is required. This is required for teachers, assistant teachers, and home visitors, family child care providers, not actually for other staff at this point. There's an exception for management staff that I'll talk about briefly when we get to section D. But no, we actually don't need you to report the cook or the janitor or even the ARCIA specialist or health aide, whatever. Those actually are not on the PIR. It's just the teaching staff for section B. Okay. Um, so we need all the fields to be filled out here. If the answer is no, go ahead and enter no or not applicable, which is an option on some of these fields. But we need to make sure that we can tell the difference between the form isn't completed and these fields don't apply. So just, again, we color coded it for a reason, make it not be yellow. Okay, in the turnover tab, as I said before, if you complete this um, now, I mean, as soon as someone leaves, you put in when they left and what the reason given was, it's easier than trying to reconstruct that 6 months later. There is a list of possible reasons on the PIR. So they ask, is it retirement? Did they leave for more pay at another job? Were they dismissed involuntarily? So those are the big ones they want to know about. The way that the PIR was reported, which is on the Head Start Enterprise System website, if you put other, then you need to explain, right? You can't just say other. They want a specific, not they're not like deeply digging into your business. They want to know um, essentially what they're trying to get at is what is the role of um, other types of teaching positions paying more in the high turnover and difficulty in hiring staff. So if that's something that you've struggled with, you do want to mention that. You're not doing yourself any favors by not communicating to the feds our struggles with hiring people. Like it's better for them to know and know that we need more money. Okay. Section C, this is the bulk of the PIR. It covers health, disabilities, education, curriculum, developmental screenings, and family and community partnership information. So when we send out data collection information, we didn't send it out by um, by section of the PIR. Instead, we organize it in the order that we need to receive it, essentially. So on our spreadsheet, we're trying to capture the initial screening data with enrollment. So we're trying to get all this now. And the reason is these are really things that should be completed at enrollment, and we need to have some idea of what's going on with these and be able to say something intelligent and reporting out on them next month. So one thing that we've done here that we didn't do last year, and we hope will be helpful here, is we put a formula in here that's going to calculate due dates for screening. So for when their health history date, which is when you're going to make a determination about whether they're up to date on the EPSDT and on the developmental screening and the social emotional screening, hearing and vision. Like we put dates in for those things. So when you add a child to the spreadsheet and you put their enrollment date in, it's automatically going to calculate a due date. So this is part of why we sent these out already, and we're asking you to put children on them. Now, we want you to see that date and get the screening done on time. And that anyone is familiar with the outcomes from our recent FA2 federal review will know that they had some concerns about health and developmental screenings. And they really need to see us get these done within the 45 days, which I will, again, every time I say this, people are surprised. This is not a CPS thing where they're talking about school days. These are calendar days. So yeah, it means a month and a half, not 2 months. That's the difference. Okay. So we're trying to capture initial screening data, and if you look closely at it, you'll see that if you get screening dates in for developmental and social emotional screening, it's going to come up with a response. It'll say true or false on whether you got that done within 45 days. We also gave you, again, auto-calculated a due date. Yeah, the dates are a little bit early. Okay, so if you do the math, you'll be like, wait, that's not quite 45 days. You're right. And the reason for that is that we've seen a lot, and this isn't just this last year, the last couple of years. I've seen a lot, and we look at the screenings, and they're 46 days, 48 days, 52 days. That doesn't count. It does not count. If the 45th day is Sunday, it is not okay for you to do it the next day on Monday. It's got to be done Friday, which would be the 43rd. All right, so don't wait until the last week to do it. Just in your head, think 30. We're going to get this done within 30 days, and then get it done. There is no reason to wait longer than that. You're not going to get a better result. And if a child needs to be referred for services, you've only delayed the referral by delaying the screening. So you should be doing these now, and then you should put these dates in now. We cannot have another year where this number hovers around when it was 70%, 60%, I don't remember, but it was not good enough. They all need to be screened. Okay. Um, when you look at health services in the PIR, and here's an example from the form itself, um, there's usually two questions on each item. There is a status at enrollment and a status at the end of enrollment. So the at enrollment questions can be entered now because they are enrolled now. And when we get later into the year, you can do the end of enrollment. The fact that it says end of enrollment doesn't mean you should wait until the last week in August to fill it out. Think about it as the end of the school year. Whatever changes should have worked through by then anyway. Okay. So this is how this works in practice. If the child is up to date on medical screenings at the beginning of the year, or that's great. They should work with the family to make sure that they stay up to date. So if a child is not up to date, then that determination should be made as soon as possible so that you can work with the family to get access to the care they need. One trend, and this is not a function of the new system or of Excel. This was the same when we were doing this report in COPA for many years. We looked in this and saw in many, many cases the number going down. So at the beginning of the year, more children were up to date on their EPSDT required screenings and services than at the end of the year. That number should not go down because you should be working with the family to make sure that they stay up to date or get up to date if they weren't. Now, part of the reason is just the thinking, the pause that you need to take when deciding whether they're up to date at the beginning of the year. Okay, so if you haven't seen their physical, they are not up to date. You should not be identifying them as up to date. Even if the family says, yes, we have a physical, but we don't have it with us today. They're still not up to date until you get that information. So again, if they're up to date at the end of the year, they would have had a screening. They would have had a physical sometime during the year. So we're asking for that date. Okay. The next big piece of the health section, item C8 asks if children have been diagnosed with any chronic medical condition by a healthcare professional. And then item C9 asks what conditions they had. Now, they're not exhaustive, so you could have C8 be higher than the number of children identified in C9 if the chronic health condition that children have is not one of the ones that are specifically broken out on the PIR. They're not just asking about these. So that makes sense if they don't agree in that direction. But if a child is identified as having any of the chronic conditions listed on C9, that's like autism, ADD, asthma, seizures, life-threatening allergies, hearing or vision problems, elevated lead levels, or diabetes. Like if a child has any of those, then on section C8, they should be marked, yes, yes, they have a chronic condition, because those are chronic conditions. So just make sure that that agrees. And then sometimes a condition is well managed and it doesn't need special treatment, but you still need to determine whether they receive treatment and give the reason that it wasn't needed if it wasn't needed. But again, don't leave that stuff blank. Okay. So, and then disabilities. This is another thing that has changed over the last several years. And it's a little more work up front, but I am pleased that it has changed. It saves a lot of work. So I'm glad that they've done this. So the PIR item C22 talks about all children who have been referred for an evaluation, okay, regardless of the outcome. So the children included in the disability section are no longer just children with IEPs and IFSPs. It's everybody. We'll get to that question next, but right now they want to know, was anyone identified as needing an evaluation? Were they referred for an evaluation? Did they get one? If so, what was the result? If not, why not? So we're including the whole universe of potential disabilities. Okay. And the reason that I'm happy with this is in the past, they did not ask us this on the PIR. But if anybody reported that they did not have 10% enrollment of children with disabilities, then they would come back and ask us this question. We would be pulling together a waiver for disabilities and would have to contact all of the agencies and get this information like 6 months after the program year has ended on the previous year. What happened? Who was screened? Were they evaluated? All of that. So now they're asking us that up front, which means after we have submitted the PIR, they don't come back and try to get that information from us later. So it saves us a lot of headache in the fall and winter. So, but be aware, they want all that information so that if you haven't achieved 10% in terms of enrolling families with disabilities, you will still be able to be showing your work and saying that we're trying to get there, we're attempting to get services for families and so on. Okay, so again, we included all these questions. These, as you can see, are the same questions that were on the form. That's why we're asking them here. We're not making this up. We're trying to make it difficult for everyone. We're just trying to answer the questions that the feds have. These It's not quite as pressing to have this information in right now as the developmental and health screenings, the 45-day and 90-day requirements, but we cannot wait till the end of the year on this either. Typically, what the feds tell us is that they want agencies to have reached a 10% enrollment by February. And if not, then they start to ask, where are you? How close are you? Are there children in process? And so on. So if you can get this information in here in the fall, we will have a better answer for the feds in the winter. Okay. So a little bit about this kind of the structure of how we laid these out for you. Like most of the other tabs, the family tab is populated from the enrollment tab. What that means is when you enter children now and indicate which grant they're enrolled in, they will already show up on the other pages. So you don't enter any kids' information directly on the health, you just enter the health information and which populated. So we get the same children. This is important because we don't want to ask several different times who's enrolled in which grant. We only want one answer for who's in early Head Start versus who's in early Head Start CCP and so on. And we don't want kids jumping back and forth between grants during the year. So again, when I talked about how we're filtering it, we put everybody on here and then we filter it down. So the issue with doing this way for child and family services is that you have siblings sometimes. So if you have multiple siblings in the same program, like they're both in early Head Start at the same time, you don't need to put the parent information in twice. What I'm asking you to do is just identify the parent as a duplicate, and then we will filter them out, and we won't include them twice in the report. But that's if they're in the same grant. This is kind of the low budget way that we're collecting this information right now. If you have one child in Head Start and another in early Head Start, we do need their information because those are different reports at the moment. They're moving towards calling everything Head Start. If you will see that in the new performance standards. So I'm not sure if at some point they will allow all the kids to be reported on the same PIR, but we certainly have not heard that. And as I said before, right now they're planning to do this exactly the same way with exactly the same form um, next summer. So the last section of the PIR are grant level questions. And so we at DFSS submit this once for each grant. Like there's a Head Start section D, there's an early Head Start section D, there's a CCP section D, there's an expansion, but it's not at the delegate level. So overall, you don't need to worry about most of it, but a couple questions that we put on here relate to this. They want to know how many are receiving intensive coaching. So we put that question because they're asking about that by class. We put that question on the class tab. The family worker qualifications from HR, we don't report that on an individual PIR, but on the grant level PIR, they ask for that overall. And then there are certain defined Head Start management positions for which they want to know the average salary. And we do need those. We didn't spend a lot of time badgering people for that information this year because we did do a survey and we had all that information that we're using to prepare the grant. So we just got our averages from there. So they're not actually reporting anyone's individual salary on this report. It's just the average citywide. So two people who have this position, what's their average pay? Okay. So why am I talking to you about this now? Why are we asking for this stuff? Initially, we sent this out before I was going to do a webinar, in fact. But last week, which seems like ages ago, we did set up the 24, 25 spreadsheets and decided on the dates, and we wanted the kids in by today. Some people have done that. If you haven't, please, you must know at this point who is in your which grant. So please get that basic enrollment information in there next week so you can see the due dates and make sure that you can populate those. This will help you track and you won't miss getting the 45-day screenings in if you do this and look at the form for reference. And so one of the reasons we're doing this is that we have been called out for not getting children screened within 45 days. It's a concern. Um, Now, that they would like to have everyone screened, but the PIR question is actually new children. So anyone who wasn't in the program last year. Um, so ideally, you started doing that already because they don't have any problem with the screening being before their start date. That's fine. It just can't be more than 45 days afterwards. Um, So particularly, we have used September 3rd as our start date. That's when all of our programming was open and delivering services. But for those duly funded agencies that started classes with CPS or even earlier, they've already had several weeks, and so they're all screened by now, right? Right? If not, there's no reason to wait any longer. They're perfectly acclimatized, and you can get off of this call and go screen them. Okay. Like now, go ahead, please. We need to get this done. Also, some of the other items here. We actually have internal departmental goals, and we report on these on a quarterly basis, attempting to improve services in key areas. That's been identified by last year's self-assessments. So until we can get a clean and well-populated report out of CSD Cares, we need to get this information the only way that we can right now, which is by populating those files in the shared folders. Okay, so we sent this out. I'm sharing this now. Um, we need the initial screenings now. We want the class data to be in here next month so we can make sure we know who's in the classroom, who's qualified, which classes are operating, which are not operating because of lack of staff, information like that. And then by the beginning of next year, we will want all the initial information in terms of health and family and so on. And as I said, the feds are going to ask us for data about disabilities come February, so we're asking for you to do the same. So we need the data. It is it's part of receiving federal and state grants is that they want information um, shared back with them about who's enrolled, what's their status, our services being delivered. So we need to be moved to where we can get accurate enrollment reporting. If you'll put everybody in, we can stop calling and harassing you. It will also help us with getting children into the new data system if we know who is supposed to be there. We need to track their health status and developmental screenings. We need to be able to do that this month and next month to be able to demonstrate that we're on target with correcting the problems that the feds identified during our FA2. It is essential that we be able to do that and show them that we are tracking this, that we're on top of it, and that the situation is improving from what they saw when they were here, which they did not like. Okay, with information helps us track towards 10% disabilities. We have, as I mentioned, development goals and milestones, and all sorts of stakeholders need information about who we have. It's not just the Office of Head Start, but the governor's office, the mayor's office, all kinds of folks. So we need to get this reported. We don't need to be pulling teeth to get information from you in July that we needed in September. So please, I hope I've gotten across how important this is, why we're asking for this. Okay. And now I will see. Thanks everyone for remaining muted. Let me see if I have questions in the chat. If there's a lot, I probably won't be able to get to it all. We are recording this, so we will respond to any questions that we have that I can't get to now. I'm not seeing a lot. Okay. Okay. Well, as I promised, this did not take 2 hours. I hope that I could get it in a timely manner because uh, this is, as I said, the first of many. So we're going to be posting this. We're going to then be delivering some on a regular basis. Roughly every other Friday. We'll see how that pans out, but that's what you should be looking for. We'll be doing something and then we'll post them. And so there'll be a library of these that you can refer to in bite-sized chunks. And again, I'm hoping some of the later ones won't even be an hour long. However, the next one, as I mentioned, is going to be enrollment in CSD Cares, and that's going to take a good chunk of time. So this time, I will be sure to record it and make it available to everyone on the internet so they can see what the expectations are going forward in terms of getting to enroll. Uh, anyway, thank you for your time today. And I think we're looking forward to a great new year in the city of Chicago. So uh, thanks, everybody.